Take your mind into the wonderful world of physical, emotional, psychological, and spiritual wellness. Ladies and gentlemen, welcome to the Kinetic Hour. Conversations with you and guests. With your host, Kenan Wesley Mason. That's me. All right, good morning, good afternoon, and good evening, and welcome to another edition of the Kinetic Hour. I am your host, Kenan Wesley Mason. Welcome one, welcome all. As always, it's always good to be here on the air for another edition of the Kinetic Hour, bringing more information and just overall internet talk to you, the viewer. Tell everyone you know to tune in to the Kinetic Hour. Go to my YouTube channels. As always, there's always two. The Kinetic Hour. The Kinetic Hour on YouTube, and that is Kinetic, Kennetic. The Kinetic Hour. And also Kinetic Fit and Wellness Info. Kinetic Fit and Wellness Info. And that's also on YouTube at Kinetic Fit. Go to those two channels. There's always good information. Kinetic Fit and Wellness Info goes into matters of health and wellness, physical health, mental health, emotional health, spiritual health, all those good things. And there's something there for everyone, no matter who goes there. There's information that can potentially help someone or a group of people. But yes, go to Kinetic Fit and Wellness Info and hear the Kinetic Hour on YouTube. More shows are coming, more guests are coming. And again, tell everyone you know to tune in. We're halfway into Black History Month. A lot of things have been happening. Yesterday was Valentine's Day. For all the lovers out there that participate in Valentine's Day. And for all those that don't. Some people look at Valentine's Day as, just another day as we move forward into the next day. The football season is officially over now. As I predicted, KC would win. And we saw that there was a shooting, I guess, at the celebration parade in Kansas City. So hopefully everyone is okay. And it's always sad to see that in times of celebration, there's always that one bad apple that falls from the tree and decides to do something to ruin the celebration. So hopefully everyone is okay with that as they celebrate the Kansas City Chiefs winning the Super Bowl, as I predicted they would win. I predicted they would go to the Super Bowl, and I predicted they would win as well for a number of reasons that I'm not going to go into on this episode. But as we saw in my last episode when I interviewed Big Truck for Super Bowl weekend, a lot of things go on behind the scenes in professional sports. And so you might want to check that out on my YouTube channel, once again, the Kinetic Hour. But going back to Black History Month, I'm going to do something a little different. I'm going to highlight a couple of people in this episode because their stories are very interesting to me, and I want to relay the message of their stories to you. And the two people that I want to showcase come from a book from my library here. It's called it's a series actually, Book of Black Heroes. And this specific book is Scientists, Healers, and Inventors, an introduction for young readers by Wade Hudson. And I'll just hold it up here so you all can see. It's a wonderful book. It highlights many different people that contributed to the further evolution of society here in America. And the first person that I want to highlight is one Jewell Plummer Cobb. Jewell Plummer Cobb. And keep in mind that this book was published in 2003. This book was published, first published in 2003. So some of the people that are highlighted in this book are no longer with us. And that includes this first lady here that I'm going to highlight. Again, her name is Jewell Plummer Cobb. And I'm going to put her picture up here. And this is actually directly from the book. And I'm just going to put her picture here up on the screen here. And her story is really interesting. And actually, all the people that are highlighted in here, nothing long, is some brief summary of their life journey and their careers. Jewell Plummer Cobb. Jewell was born in a family of doctors and PhDs. Her father had a medical practice in Chicago, where he cared for African-American patients. Following in her father's footsteps, Jewell became a third-generation doctor. Her son, a radiologist, became the fourth. Despite being surrounded by doctors and science all her life, it wasn't until Jewell was a sophomore in high school that she looked through a microscope in a laboratory and decided that biology was for her. After graduating from high school, she attended the University of Michigan, but she left because Black students were not allowed to live in the dormitories. This was in 1941. She transferred to Talladega, which is in Alabama, a Black college, and graduated in 1944. After receiving her doctorate degree in cell biology from New York University, or as we know as NYU, in 1950, Jewell did cancer research. She wrote over 36 papers and performed extensive studies of cell biology with the hope of finding some clue to the cure for cancer. Jewell became very well known as a prominent cancer researcher. During her career, Jewell has held many faculty and administrative positions at various universities, including deanship at Connecticut College and Douglas College at Rutgers University in New Jersey. All the while, she continued to conduct research. In 1981, she was named president of California State University at Fullerton, which at the time had a student enrollment of 22,000. With that appointment, Jewell became one of the few African-American women to head a college or university. Jewell, and in this case, Jewell is currently, because this was written in 2003, Jewell is currently serving as president emeritus at Cal State Fullerton as a trustee professor. But despite her success as an administrator and educator, Jewell still considers herself first and foremost a biologist. Jewell is worried, however, that more African American students are not going into science. And this is her quote: "When I see more Black students in the laboratories than I see on the football field, then I'll be happy." And that is from Jewell. That's Jewell Plummer Cobb, cell biologist. And for those that go to Cal State Fullerton, which is only about 15 to 20 minutes away from here, it's in Orange County. I'm here in Los Angeles County, so it's not too far. So for all the students, current and past students that attended Cal State Fullerton, if you were in the science department, you know about Jewell Plummer Cobb, and she's passed away now. She passed away in 2017. But she went into the studies of cancer research. And I did a show a couple of months back, or earlier, actually last month, on women and breast cancer, because I actually did a piece about CNN correspondent Sarah Seidner, who publicly gave information to the public that she was diagnosed with stage 3 breast cancer. And she also stated that on television that chemotherapy, because she had already done rounds of chemotherapy, that chemotherapy is a poison. Is. Not maybe, not might be, it is. And this is coming out of her mouth. It is a poison, but we use it to help us survive. And I also said that I hope that Sarah Seidner comes out on the other side okay and healed, because she also mentioned that she was going to do the standard allopathic protocols, chemotherapy, radiation, and she said she was willing to have a double mastectomy, meaning that she is considering allowing allopathic medicine to remove both of her breasts, because these are the options that standard medicine gives to women that are ill-informed about what cancer truly is, how it affects women and men, breast cancer specifically. But as far as cancer as a developed condition, and kudos to Jewell Plummer Cobb for wanting to find some way that cancer can be healed, because cancer is an epidemic here in America and has been for quite some time. For women and for men, but specifically for women, this month is Black History Month. So for Black women especially, because Black women statistically are more likely to lose their lives due to complications of the treatments. Allopathic medicine will say it's due to complications of the cancer itself, but cancer is an indicator. The tumor is an indicator that something needs to change or something needs to be looked into, and a solution is needed. This is the body alerting the person that there's some sort of malfunction in the body and that we need some immediate attention. But as we would have it, more and more women, especially Black women, are losing their lives, or they're developing breast cancer in higher numbers. One of the biggest reasons is because of emotional traumas or emotional traumatic events that haven't been addressed for possibly 10, 20, 30 years. And it tends to manifest into a cancer because the energy is just kind of expanded and expanded, the negative energy. And most people just don't understand, unfortunately, that cancer is a development. It just doesn't fall out the sky one day. And it can be hereditary only because the patterns haven't been broken. The patterns, the family patterns, the family dynamics, the family way of doing things every generation. So if grandma had cancer or auntie had cancer, and we have no earthly clue why, then the pattern persists into the next generation and the next generation after that, because we don't have the correct information on what cancer truly is and how it can be healed. Not by chemical therapy, no, not by artificial radiation, where you have a radiologist, frying your insides with artificial radiation, not radiation from the sunlight or sun rays. No, we're afraid to go out into the sunlight and absorb the natural radiation that makes all the plants and trees grow. But we'll entertain artificial radiation. And then lastly, surgery. Cancer can be healed not through surgical procedures or taking the cancer out or removing the tumor or removing the polyp or removing, in the case of many darker skinned women, the fibroids, which are smaller tumors in the reproductive area of the female. And fibroids develop for a few reasons, but nonetheless, they are considered a more smaller or minute version of cancer. But nonetheless, they're tumors. They're small tumors that pocket toxic material, whether it be toxic physical material or toxic energetic material. The body does anything and everything that it can to protect you at all costs so you can live. So it's not necessarily the cancer or the tumor that people are losing their lives. No, it's not that. It's complications from the treatments. And I've seen enough people over the years since it's been 2 decades since I've been in this field of holistics and natural health and healing. I've seen enough people and have known enough people personally, people in my family. I've talked about my brother numerous times with his specific cancer, osteogenic sarcoma. And I've seen what the treatments do. And there has been and there are natural treatments and natural remedies from all over the world that have been used and utilized by many people from various walks of life, from varying cultures, that have healed themselves. There's plenty of documentaries out there from people that have healed themselves from cancer. So just know that cancer can be healed. No one has to develop cancer. of any kind, when we have the right type of thinking patterns, or when we develop the correct thinking patterns and start looking at life a little differently, we'll start looking at cancer very differently, and how we approach the healing of cancer, no matter where it shows up in the body, and no matter at what age. Whether we see people, children in these children's hospitals with cancer, which, you know, I will go as far as to say that they're being used as experiments. These are innocent children that are being used as experimental figures for the latest in technological treatments or technological advancements because of cancer research that's still persisting today. You know, there's been a war on cancer. I've said this time and time again. There's been a war on cancer since the National Cancer Act of 1971. And then President Richard Nixon declared war on cancer in 1972. And the war has not ended as of yet. The only way you're going to win the war on cancer is when you have the right information to win the war on cancer yourself. Your body has everything it needs, and you can supplement your body with everything that it needs so you can rid yourself of any and all cancers: brain cancer, pancreatic cancer, liver cancer, doesn't matter where it shows up, lung cancer, prostate cancer for men, uterine cancer for women, cervical cancer. But I do commend Jewell Plummer Cobb for taking an initiative, for wanting to find a cure for cancer, especially for Black people specifically. So kudos to her and her developments and what she was able to do during her time at her various universities and right here locally, Cal State Fullerton.